So there is a significant measles outbreak going on in Texas currently, centered out in sort of the West Texas, southern plains kind of area of Texas. And because of that, a lot of people are wondering about their measles vaccination status. If you were born before 1957, it's assumed and presumed that you are immune to measles because it was so common back in those earlier time periods. If you were born 1957 or later, you should be vaccinated. So a lot of folks probably have been vaccinated, but you should definitely check your own records. And if you're not sure whether you've been vaccinated or not, you should talk to your healthcare provider. They can help you think through the options. There is a blood test that you can do to tell if you have immunity to measles. You can also just get the vaccine if you're not sure. If you have been vaccinated before but don't remember and you get another vaccine, it does not hurt to get an additional vaccination against measles. How is measles contracted, and what should you do if you think you might have it? Measles is highly contagious. So if somebody with measles is in a room with 10 other people who aren't protected, who haven't been vaccinated, we expect that 9 out of those 10 people will contract measles. It's spread through respiratory droplets like coughing and that kind of thing, but also through airborne transmission, which means it lingers in the air and it lingers for quite a while. If somebody with measles is in a room and then leaves that room, the measles virus can still be present in a form that can infect other people for up to 2 hours after the person with measles left the room. So it's highly contagious and does stick around in the air for quite a while. If you get measles, typically it starts, the symptoms that you get start with fever, cough, runny nose, conjunctivitis like pink eye, red eye. And then 2 or 4 days later is when kind of the classic measles rash usually starts, and oftentimes the fever will spike around then. People with measles also are contagious for 4 days before they get the rash to 4 days after they started getting the rash. So people can have measles and be spreading it before they develop the classic kind of measles rash. So that's one of the reasons why it can get around in a community. So if you think that you might have measles, it's important to call your healthcare provider and let them know that you're concerned you might have measles and explain why. They'll ask you some questions and they'll help you figure out how best to get assessed and tested to see if you do have measles. They may want to give you some special instructions for how to come in to get assessed and get tested, because we definitely want to prevent spreading measles within a healthcare facility. So you might be asked to wait outside when you arrive at your healthcare providers and call to let them know you've arrived so that they can make for special arrangements, either to do an assessment or do testing while you're outside the facility, or they might bring you back into the facility to a special location where you're not walking through the whole facility and might expose other people to measles. Are there any preventive measures that people can take to protect themselves? There definitely are. The most important thing that you can do to protect yourself from measles is to be vaccinated. Children get vaccinated at 12 to 15 months old and then get a second dose at 4 to 6 years old. Those are critical vaccinations for children to get. During a period of outbreak, that schedule does get adjusted. Right now in the Central Texas area, we don't have any local outbreaks, so there is no recommendation to vaccinate differently from that routine schedule currently. But if the situation changes, we might recommend some differences in the timing of the vaccinations. But right now, children are recommended to get vaccinated at 12 to 15 months old, and that second dose at 4 to 6 years old. For adults, they should get 1 to 2 doses of vaccine, or should have had 1 to 2 doses of vaccine. And adults should talk to the healthcare providers about their particular situation to know whether 1 or 2 doses is appropriate for them. There are a few people who either shouldn't get vaccinated or should delay the vaccination. So pregnant women should wait until after they're no longer pregnant to get the measles vaccine. And people who are severely immunocompromised shouldn't be vaccinated with the measles vaccine. And then, of course, if you had the measles vaccine before and had a severe allergic reaction to it, those folks also would not need the measles vaccination dose. The measles vaccine is very effective at protecting people from getting the measles. After the first dose of vaccine, you get about 93% protection, and after the second vaccine, after the second dose, you have 97% protection. So it's extremely effective. The vaccine is also very safe. Like with all medicines, you can have some side effects, but they're usually mild and they usually go away by themselves. But things like a little bit of fever, some soreness, redness, or swelling at the vaccine site, or some joint stiffness or pain can sometimes occur. But those, like I said, are usually mild and go away on their own. There have been stuff in the news and people who have talked about a link between autism and the measles vaccine. That has been studied very thoroughly, and there has been no link found between the measles vaccine and autism. So it is a very safe vaccine. I think another thing that's important for people to know is that measles can have severe complications. So most people with measles do recover from it fine, but there are complications that can occur. The most common complications we see in children are ear infections, diarrhea, and pneumonia, but the pneumonia can be quite serious. About 1 in 5 children who contract measles wind up getting hospitalized. About 1 in 20 will develop pneumonia. 1 in 1,000 will develop encephalitis, which is swelling of the brain. That can lead to seizures and even developmental delays and things like that later on, as well as deafness. So it can be quite serious. Between 1 in 3 out of 1,000 children who get measles die from measles. It's a serious illness. The good news is that the vaccine is safe and is very effective, protecting 97% of the time against measles after you've had that second dose. So we have a great intervention that we can offer to people, protect them from getting the measles, and we encourage everybody to make sure that they are up to date with the measles vaccine. Thank you so much for watching. We appreciate your interest in learning more about measles and measles vaccination. If you have any questions, you can leave them in the comments and we'll work on getting responses to those.